name is Marimar Mateo. I'm your very nursing student for the day. I'm washing my hands for 40 to 60 seconds to prevent the spread of nosocomial infections, and I'm also putting on my gloves.
Okay.
So today I'm here to complete a head-to-toe assessment. Is that okay?
Yes.
Thank you so much. First, can you tell me your first, last name, and date of birth?
Yes. It's Tabitha Sanchez, 5595.
Thank you so much. Are you experiencing any discomfort or pain at the moment?
No.
Okay, good. So I'm going to first start by taking your vital signs. First, I'm going to go ahead and palpate your pulses, okay, your radial pulses. I'm doing this for 60 seconds. I'm checking both at the same time to check for symmetry, and they are symmetrical. So they're within the normal range of 60 to 100 beats per minute. I'm also going to go ahead and check for capillary refill, and I see that it is less than 3 seconds, which is good. While I'm here too, I'm going to go ahead and check for your oxygen saturation, and it's between 90 to 100, which is also within range. After this, I'm going to go ahead and check your blood pressure with a BP cup, of course, and a BP machine. And I see that your blood pressure is within normal limits. It's not higher than 120 over 80. So now I'm going to check your temperature. Your temperature is 98.3, so at the moment you do not have a fever, and that's good. So now can you tell me where you are?
Hospital.
Do you know what year we're in?
2020.
Okay, good. You told me your first name, you told me what date it is, and year, and where you are, so you're oriented to time, person, and place, which is good. That's like a mini neuro assessment. Okay, so now I'm going to go ahead and start by assessing your head. So your head, I see that in your scalp, you don't have any lesion, lice, or any scratches or bleeding that will be visible. Okay, so now I'm going to go ahead and move down to your eyes. I'll be checking for perla. Okay, so it's brisk. Your pupil is reactive and accommodates to light, which is good. I see that your outer compass of your eye is symmetrical to the pinna of your ear, which is good. Here I'm also going to be checking for your mucous membrane. Can you go ahead and open your mouth? Okay, good. So I see they're pink, moist, and also your nostrils. Good. Can you smile for me? Can you stick out your tongue? Okay, so that's just testing some cranial nerves. So they're intact. Now I'm going to go ahead and look at your neck. You have no jugular vein distension, and now I'm going to go ahead and palpate your carotid one at a time. Okay. All right. Now I'm going to go ahead and use the bellum my stethoscope to auscultate to see if there is any bruise present, which is turbulent blood flow. Okay, good. No bruise was heard, which is a good sign. Okay, so now I'm going to go ahead and ask you to move forward for me, please. I'm going to be assessing your heart sounds and your lung sounds while I'm here. First, I'm going to go ahead and start by assessing, auscultating your heart sounds. So aortic, pulmonic, Erb's point, tricuspid, and mitral, which is also known as the point of maximum impulse. So I heard no murmurs, and S1 and S2 sounds are present. There's no extra heart sounds like S3 or S4, which is good. So now I'm going to go ahead and auscultate your back. Take a deep breath for me every time I move the stethoscope. Okay, so while I was auscultating your back, I see that all the lung fields are clear. There are no adventition sounds present, which are like crackles or rails or wheezing, which is good. And while I'm also assessing your AMP diameter, the ratio is how it's supposed to be, 2 to 1. So I'm also going to go ahead and assess your skin back here, your coccyx area, to see if there's any skin breakdown, and there is none. I see that your skin color is also evenly distributed throughout, and there's no skin breakdown anywhere. You can go ahead and sit back. Thank you. So now I'm going to go ahead and assess your abdomen area. First, I'm going to start by auscultating to see if there's any bowel sounds present. Okay? I'm going to go ahead and lean you back a little bit. Thank you. I'm starting at the right lower quadrant. So all bowel sounds are present in all 4 quadrants. When was the last time you had a bowel movement?
Yesterday.
Okay. Did you experience any pain or discomfort?
No.
Is that your regular?
Yes.
Okay, good. So now I'm gonna go ahead and palpate. Do you guys feel any tenderness? Okay. So I was palpating. I also was looking to see if there's any bladder distension, and there is none. When was the last time you went to urinate?
20 minutes ago.
Okay, good. Can you describe the characteristics to me? Is it yellow? Is it clear? Does it have a foul odor?
Clear and no odor.
Okay, good. That means that you're hydrating well, and that's good to drink water.
Mm-hmm.
Okay, so now I'm gonna go ahead and tell you that I see that you have an IV catheter on, and I don't see any signs of phlebitis, which is like redness and inflammation. I see that it was placed in 2 days ago, and I'm gonna flush it, and it's intact, and you have no IV fluids flowing at the moment, so it's just a head block. Thank you. So now I'm gonna go ahead and move down to your lower body, first assessing the rest of your skin. So I see that it's also evenly distributed for your ethnicity. It's appropriate. I'm also going to be checking your other pulses, which is like the popliteal here, both to see if they're symmetrical. And yes, they're there and they're symmetrical. So also there's no edema present, and your hair is evenly distributed, which is a good sign of circulation. Also, I'm going to be assessing your pulses, your pedal pulses. And while I'm here, I'm gonna also ask you to push against my hands to check for range of motion. Can you lift your legs? One at a time. Okay, good. Against my hands. Okay, so you have good range of motion against gravity and strength. Okay, so I'm also checking your toes for cap refill, and it's also less than 3 seconds. So that concludes the head to toe assessment. Do you have any pain at the moment?
No.
Discomfort?
No.
Okay, so I'm gonna leave the call bell near you. If you need anything, call me. I'll be back in a couple minutes to give you your medication.
Okay.
Okay? Are you okay?
Yes.
Thank you so much. So I'm taking off my gloves and washing my hands again for 40 to 60 seconds, and I'm exiting your room.
Thank you. Bye bye.
Bye.